Hello everyone, my name is Julie Vang, and today I will be presenting about a profession within the healthcare field. The profession that I have chosen to speak about is radiology technician. And as some of you may have heard about this profession but is not really sure what exactly they do, well, that's what I'm here for. A radiology technician is someone who specializes in radiology. They perform fluoroscopy procedures, basically just shooting x-rays on a patient. And this may be a still picture, such as like a chest x-ray, or even like a leg x-ray or an arm x-ray, or even motion x-rays, such as a swallow test. Now for myself, I have actually been able to view a swallow test, and I think that this is actually very cool to see, because you can see, because whenever they do a swallow test, they have the patient sit in front of the x-ray, and they will have the patient swallow food that is mixed with barium. Barium is just something that will help the technician see the food going down, whether it's going down the esophagus or the airways of the patient as they swallow the food. And this will kind of help determine the diet the patient can eat, as well as whether or not they can intake solids. Some of the other things that I will be discussing within this presentation is how exactly does one become a radiology technician, as well as the salary of a radiology technician when working in the state of North Carolina, and also the job outlook. So in order to become a radiology technician, the individual has two choices. They can either go through a 2-year program, which is typically known as an associate's program. You can apply for a program that offers it at a community college within the state of North Carolina. One that I know well of is the program being offered at CPCC. With that program typically takes about 5 semesters, which is about 2 years. Or you can actually apply to a bachelor's program, which will typically take about 4 years. And I know, based on my own research, UNC Chapel Hill actually offers a program in radiology that specializes in radiology. So after completing and getting your certification as a radiology technician, you can actually earn up to about $60,000 per year. The lowest being recorded is about $40,000, and the highest being recorded being about $86,000 per year. And then obviously pay really just depends on your certifications, as well as how experienced you are at the job when working in this field, and also where you're working at, because working in the hospital, being paid there in the hospital is actually very different than being paid while you're working in like an outpatient clinic. And of course, as any other field within the healthcare field, it's still growing and expected to grow about 12% within the next 5 years. So in 2016, it is expected to grow about 12% from this point on. And obviously one of the main reasons with this is because there has been an increase in demand for diagnostic imaging. So in order to help diagnose patients, you can't exactly see what's wrong from the outside. So you have to use this kind of technology to help you view what's wrong on the inside, because that's mainly what's wrong with the body. So either you have a broken bone, or you have cancer, or you have pneumonia. X-rays can help view that and help you diagnose how to treat this condition. And now that I have talked a little bit about the profession of radiology technician, I really do hope that you have taken something away from this. I hope you at least know now that there are other professions within the healthcare field other than nursing and doctors, because if you, like, for me personally, I know that patient care is not really for me, and I know that going to medical school is not really something that I would want to spend my time on. So knowing that there are other professions within this field that can help people on a day-to-day basis, that can allow you to help people in your own way, really encourages me to try and encourage others to look outside of the perspective of nursing and going to medical school. All right, so that is the end of my presentation. I again just want to thank you for taking the time out of your day to come by and listen, and I hope everyone has a good day. Thank you.